Most men over 60 believe losing their erection is just aging. But after 30 years as a urologist, I can tell you this. It's often your blood vessels quietly shutting down, not your masculinity fading. I've looked into the eyes of men who told me, "Doctor, I don't feel like myself anymore." Men who avoided intimacy, who felt their confidence slipping away, not because they were old, but because their circulation was failing them. I'm Dr. James, and what changed everything for many of my patients wasn't a drug, wasn't a hormone injection. It was something so small, so overlooked, most men either ignore it or use it completely wrong. A tiny seed that helps your blood vessels open again, naturally. If you've started noticing weaker erections, less desire, or that quiet frustration you don't talk about, stay with me, because the first thing you need to understand is what's really happening inside your blood flow right now. So before we talk about that tiny seed, you need to understand the real reason your body is no longer responding the way it used to, because what's failing first isn't your desire. It's your blood flow. 1. The real problem isn't aging. It's your blood vessels quietly closing. Let me be direct with you, because this is where most men get it wrong. What you're experiencing right now, that weaker erection, that loss of firmness, that moment where your body doesn't respond the way it used to. It's not simply because you're getting older. It's because your blood vessels are slowly losing their ability to open. And when that happens, everything changes. You see, an erection is not about willpower or even just testosterone. It's about blood flow. Your body relies on a simple signal, a molecule called nitric oxide, that tells your blood vessels to relax and expand so blood can flow where it needs to go. But over time, due to poor diet, lack of movement, chronic stress, and silent inflammation, that signal weakens. The vessels become stiff, narrow, less responsive, and the first place you notice that is in your performance. I remember a patient, Mr. Reynolds, 71 years old. He sat in front of me and said quietly, "Doctor, I still feel the desire, but my body just doesn't follow anymore." That sentence stayed with me, because it wasn't just physical, it was emotional. He started avoiding intimacy. He felt embarrassed, less confident, like he was slowly losing a part of himself he couldn't explain. And here's the truth I told him, and I'm telling you now. This is not the end. This is a signal. Your body is telling you that your circulation needs attention, because when blood flow improves, function often follows. So where do you start? Not with complicated treatments, not with extreme changes. You begin by supporting your blood vessels every single day. Simple habits. Foods that help your body produce and protect nitric oxide. Small, consistent steps that reopen what has slowly been closing. And once you understand that, something shifts, because now you're not guessing anymore. You're working with your body, not against it. But here's what most men don't realize. Even if your body starts producing nitric oxide again, something else may still be blocking the effect completely, and that's what we need to look at next. 2. The tiny seed. Flaxseed, the natural foundation for opening your blood vessels. Now let me show you something most men overlook. The one simple habit that can begin to reopen what's been quietly shutting down. Flaxseed, a tiny seed, easy to ignore, but inside it is one of the most powerful natural supports for your blood vessels that I've seen in my entire career. Because if your problem is blood flow, and for most men over 60 it is, then you have to start at the level of your vessels. Flaxseed works by helping your body produce and preserve nitric oxide, the signal that tells your blood vessels to relax and open. When that signal improves, circulation improves. And when circulation improves, function follows. Stronger erections, better response, even more stable energy throughout the day. I had a patient, Mr. Collins, 69 years old. He came to me after months of frustration. "Doctor, it's not completely gone, but it's not reliable anymore." That uncertainty had already started affecting his relationship. He was pulling away, avoiding closeness, not because he didn't care, but because he didn't trust his body. We didn't jump to medication. We started with his foundation. I asked him to add one simple habit, 1 to 2 tablespoons of freshly ground flaxseed every day. Nothing complicated, just consistent. About 5 weeks later, he came back and said something that stuck with me. "It's not perfect, but it's coming back, and I feel like myself again. That's the difference. Not instant results, real recovery. And I want you to hear this clearly. This is not about age taking something away from you. This is about giving your body what it needs to function again. Flaxseed helps reduce inflammation in your blood vessels, supports smoother circulation, and creates the conditions your body needs to respond naturally. But here's the part most men miss, and it's a mistake that can completely cancel out the benefits. Because if you're using this tiny seed the wrong way, your body may not be getting anything from it at all, and that's exactly what we need to talk about next. 3. The hidden mistake. You're using flaxseed, but your body isn't absorbing it. Let me stop you for a moment, because this is where many men lose the benefit without even realizing it. You can be doing the right thing and still see no results. I've had patients come in and tell me, "Doctor, I tried flaxseed. It didn't work." And when I ask one simple question, "How are you taking it?" the answer is almost always the same: whole seeds. And that's the problem. Flaxseed has a hard outer shell that your body cannot break down easily. If you swallow it whole, it passes through your system almost untouched. No absorption, no benefit, which means no improvement in blood flow, no support for nitric oxide, and no change in performance. I remember a patient, Mr. Walker, 73. He was disciplined, ate clean, stayed active. He had been adding flaxseed to his meals for months, but nothing changed. His erections were still weak. He was waking up multiple times at night to urinate. His energy was low, and more than anything, he was frustrated. He felt like he was doing everything right and still losing ground. When we looked closer, the issue was simple. He was eating whole flaxseed. I asked him to switch to freshly ground flaxseed, just 1 to 2 tablespoons a day, and store it properly so it stayed fresh. Within a few weeks, things began to shift. Not dramatically overnight, but enough for him to notice. Better morning response, fewer interruptions at night, more confidence, and that small change made all the difference. So if you're going to use this tiny seed, you have to use it the right way. Grind it fresh. Keep it in a sealed container. Use it daily. That's how your body actually gets what it needs to support your blood vessels and circulation. And here's what I want you to understand next. Even when you start using flaxseed correctly, even when your body begins to produce more nitric oxide, there is something else happening inside your body that can quietly destroy that progress, and most men have no idea it's even there. 4. The silent destroyer. What's breaking down your blood flow from the inside? Now here's something most men never see coming. You start doing the right things, you improve your diet, you even add flaxseed, and still, your body doesn't respond the way you expect. That's because there's a hidden force inside your body quietly working against you. It's called oxidative stress. You don't feel it directly, but you see the effects. Your erections become weaker, harder to maintain. Your energy drops. You wake up tired. Sometimes you notice more frequent urination at night, and it all connects back to one thing: your blood vessels are under attack. Inside your body, unstable molecules, free radicals, are breaking down nitric oxide before it can do its job. So even if your body is producing it, even if you're supporting it with the right foods, it gets destroyed too quickly, and your blood vessels stay tight. I remember a patient, Mr. Bennett, 70 years old. He told me, "Doctor, I feel like something starts, and then it just fades." That was exactly what was happening. His body could initiate the process, but it couldn't sustain it. Not because he was too old, but because oxidative stress was interfering with his circulation. He had years of accumulated damage from poor sleep, processed food, and constant low-level stress. Nothing extreme. Just enough, over time, to weaken his system. Here's the good news. This is something you can influence. You don't need complicated treatments. You need to protect what your body is already trying to do. Simple changes make a difference. Add foods rich in natural antioxidants. Pumpkin seeds, for example, are a simple addition. They help protect nitric oxide and support your blood vessels so they can actually stay open. Combine that with flaxseed, and now you're not just producing the signal, you're preserving it. And this is where things start to come together, because once you protect nitric oxide, your body begins to respond more consistently. But there's still one more piece missing. Even if you protect it, your body still needs the raw material to create it in the first place, and that's what we're going to uncover next. 5. The missing building block. Your body can't produce enough nitric oxide. Now let me ask you something simple. What if your body isn't failing? It's just missing what it needs to work. I see this more often than you'd expect. Men come to me doing everything right, eating better, taking care of themselves, even supporting their blood vessels, but their results are inconsistent. Weak erections, difficulty maintaining firmness, low energy that doesn't match how they feel mentally, and the reason is often overlooked. Their body doesn't have enough raw material to produce nitric oxide in the first place. Because nitric oxide doesn't just appear out of nowhere. Your body has to build it, and to do that, it needs specific nutrients, especially compounds that convert into something called arginine, which is the direct fuel for nitric oxide production. I remember a patient, Mr. Lawson, 66. He told me, "Doctor, it's frustrating. I feel like everything is almost there, but something's missing." That was exactly it. His system was trying to respond, but it didn't have enough of the building blocks to complete the process. So the signal was weak, inconsistent. His confidence started to drop, not because he lost desire, but because he couldn't rely on his body anymore. Here's the part that should give you hope. This is not permanent. Your body can rebuild this pathway if you give it the right support. Simple foods can help. Watermelon seeds, for example, contain compounds that your body can convert into the materials needed to produce nitric oxide more effectively. You don't need large amounts. You don't need anything extreme. Just small, consistent additions that support what your body is already designed to do. When you combine this with what we've already talked about, supporting blood vessels with flaxseed, protecting nitric oxide from damage, you begin to see a pattern. You're not forcing your body, you're rebuilding its natural system. But even when your body produces enough nitric oxide, even when you protect it and support it, there's still one powerful force that can override everything and keep your blood vessels tight. And most men are dealing with it every single day without realizing it. 6. The daily trigger. Stress keeps your blood vessels locked tight. Let me tell you something most men never connect to their performance. Stress doesn't just live in your mind, it lives in your blood vessels. You can be eating better, supporting your body, even doing everything we've talked about so far, and still feel like your body won't respond. Because when your system is under constant tension, your blood vessels stay tight. They don't open the way they should, and without that opening, blood flow never fully reaches where it needs to go. That's when you notice it. You get partially firm, but not enough. Or you lose it halfway through. Or your desire is there, but your body feels disconnected. Over time, this creates frustration, doubt, even avoidance. I remember a patient, Mr. Carter, 74. He told me, "Doctor, I don't feel stressed, but something just isn't working." And that's the thing. This kind of stress is often silent. It builds over years. Poor sleep, financial worries, lack of recovery. Your body stays in a constant state of alert. And when that happens, it sends signals that tell your blood vessels to constrict, not relax. So even if nitric oxide is present, the body overrides it. Here's the good news. This is something you can shift. You don't need to change your entire life overnight. Start small. Simple habits that calm your system and allow your body to relax again. Deep breathing for a few minutes in the morning. A short walk after meals. Even something as simple as reducing stimulants late in the day. And certain natural supports, like compounds found in celery seed, can help your blood vessels resist that constant tightening signal. When Mr. Carter began making these small changes, he didn't just notice improvement physically. He told me, "I feel more in control again." And that's what this is really about. Not forcing your body, but allowing it to function. But now we need to talk about the biggest mistake I see men make, the one that quietly makes everything worse over time and keeps them stuck without realizing it. 7. The biggest mistake: waiting too long and ignoring the early signs. Let me be honest with you. The biggest damage I see isn't from age, it's from waiting. Men notice the early signs, slightly weaker erections, less consistency, waking up more at night to urinate, a drop in desire, but they brush it off. They tell themselves it's normal, that it will pass. Or worse, they avoid thinking about it altogether. But here's what's really happening. Those early signs are your body's warning system. Your blood vessels are starting to stiffen, your circulation is declining, your prostate may be under stress, and if nothing changes, those small signals become bigger problems, harder to reverse, more frustrating to deal with. I remember a patient, Mr. Daniels, 72. He told me, "Doctor, I wish I came to you 2 years ago." Back then, his symptoms were mild. Occasional difficulty, slight hesitation, but he ignored it. By the time he came in, the problem had progressed. Not beyond help, but it required more effort, more time, more patience to restore. And what affected him the most wasn't just the physical side. It was how it made him feel. Distant, less confident, like he had lost control over something deeply personal. Here's what I want you to understand. This is not about fear. It's about awareness. Your body is not failing you. It's communicating with you. And when you respond early, the results are very different. Because the same system we've been talking about, your blood flow, your nitric oxide, your vascular health, can be supported, improved, and in many cases, restored. But it starts with a decision, not later, now. So what can you do, starting today? Keep it simple. Build your daily routine around what actually supports your body. 1 to 2 tablespoons of freshly ground flaxseed as your foundation. Add small supportive elements if you choose. Stay consistent. Give your body time to respond. This is not about quick fixes. It's about rebuilding function from the inside out. And once you begin to take control again, everything starts to shift, not just physically, but how you feel about yourself. Now let me bring this all together for you, because this isn't just about performance, it's about something much deeper. 8. Reclaiming control. What your body is trying to tell you. There comes a point in every man's life when the body begins to change, not all at once, but quietly, gradually, in ways that are easy to ignore until they're no longer small. What you've seen today is not just about erections, or even just about blood flow. It's about understanding that your body is more responsive and more fragile than most men realize. The difference between decline and recovery often comes down to awareness. When you understand what's really happening inside you, you stop guessing, and you start acting with purpose. Because the truth is, over the next 1 to 5 years, your body will continue in one of 2 directions. If nothing changes, blood flow will decline further, your prostate may become more problematic, your energy and confidence may continue to fade. But if you begin to support your body now, through simple, consistent habits, you can slow that decline, and in many cases, reverse parts of it. This is not about chasing youth, it's about protecting function, preserving dignity, staying connected to who you are. Your body is not working against you, it's asking for support, and when you respond the right way, it responds back.